Hi, welcome to Medverse. In this YouTube channel, we discuss your MBBS professional exam questions. So today's topic is RPGN, which is rapidly progressing glomerulo nephropathy. So RPGN is a type of rapidly progressing renal failure. What are the features of renal failure? Renal failure leads to actually no or lesser urine formation. So that means oligouria or anuria. And then RPGN or rapidly progressive glomerulonephropathy is another type of rapidly progressive renal failure. So what is the difference between acute kidney failure or acute kidney injury and RPRF, rapidly progressing renal failure? The difference is rapidly progressing renal failure occurs in days to weeks time, but AKI occurs in hours to days time. Okay, so rapidly progressing renal failure causes are glomerular, tubular, vascular, etc. So anything can happen, but our focus in this topic is glomerular causes. Our focus is glomerular causes like RPGN. Our focus is glomerular causes. So RPGN is characterized by crescents in glomerulus. Now let's get back to this picture. This is the normal glomerulus. This is the normal glomerulus where you have a Bowman space. This space is empty. This is Bowman space. You have a Bowman space. You have a Bowman space. And these are all capillaries. These are all capillaries. These empty things are all capillaries. So this gap is there. Between capillaries there are mesangial cells. Okay, this is the normal glomerulus, but in this glomerulus you can see these capillaries are quite compressed, and this Bowman space is filled by some other cells and tissues. So this is actually is a crescent. So RPGN is characterized by crescent formation, or half. This is like a half moon shape or sickle shape. This space is crescent. Okay, so what forms the crescent? Crescent is formed by proliferating parietal epithelial cells, and deposited fibrin. In normal cases, fibrin cannot come into this Bowman space because there is a glomerular basement membrane which has negative charge, which repulses any protein to come into Bowman space. But as this glomerular basement membrane breaches due to any glomerular pathology, this fibrin comes outside, and there is this ongoing inflammation, and this RPGN is formed. So capillaries will be compressed. Now your kidney cannot form urine. So what are the features of RPGN? With what feature a patient may present to here? There will be severe oliguria. This needs no explanation, and that will result into very high blood urea nitrogen. That means urea creatinine. So high urea will lead to uremia. Uremia will lead to risk of high bleeding. So the diagnosis of RPGN, when you suspect that, you need to perform renal biopsy. But due to uremia, you cannot perform it because there is a high risk of bleeding. So first you have to correct this uremia by repeated multiple hemodialysis. Okay, then bring down this serum urea, and now you can perform. There will be hypertension also, because mostly nephritic syndrome causes can lead to RPGN. So there with nephritic syndrome, hypertension is associated. So hypertension is a feature. Moderate proteinuria will be there, pulmonary edema, and one of the main causes of rapidly progressing renal failure is Goodpasture syndrome. Goodpasture syndrome is caused by anti-glomerular basement membrane antibodies, and it also affects the alveolar basement membrane. So RPGN ensues, and diffuse alveolar hemorrhage ensues. So which results into hemoptysis. So results in hemoptysis. Okay. So let's go to the histology of RPGN. I said you that there will be crescent. Yes, you have to actually draw the schematic diagram in your exam to show that you understand this, what is crescent. So crescent is formed by proliferating parietal epithelial cells and deposited fibrin. It can be seen in light microscopy. And everywhere in RPGN, everywhere you can find, anywhere you can find high cellularity, that is endocapillary, I mean glomerular, or extracapillary, anything. Mesangial hypercellularity actually will be there. Crescents will be formed, and the more number of crescents, the poorer the prognosis, and also the more the fibrous crescents are there, the more poorer the prognosis, and the glomerular capillaries, glomerular whole structure will be quite collapsing. RPGN classification according to the etiology. So etiology, GPS is Good-Pasteur syndrome. In case of Good-Pasteur syndrome, anti-glomerular basement membrane antibody is formed, which gets deposited in the basement membrane. So if you do immunofluorescence, there will be linear deposits of IgG in glomerular basement membrane. Type 2 is immune complex deposition. So in type 1, these anti-GBM antibodies are targeted against your alpha 3 non-collagenous domain of alpha 3 chain of type 4 collagen. Okay, that is called NC1 domain of alpha 3 chain of type 4 collagen. Type 2 is different. Type 2 is different because immune complex deposition, but these immune complexes are formed elsewhere in the body due to any antibacterial, due to any bacterial antigen, etc., causing autoimmune reaction. So those antibodies and antigens will come into the glomerulus, and they will get deposited in your glomerulus. So what will happen? The causes are adult PIGN, which usually PSGN is due to post-streptococcal infection. PIGN is usually it can be streptococcal, it can be MRSA also. Adult IgA nephropathy, which is Henox-Conline purpura, HSP, SLE. In case of SLE, full house pattern is seen in immunofluorescence, because all sorts of all sorts of complements and antibodies will get deposited. Type 3 is ANCA positive. So ANCA positive diseases are Wegener's granulomatosis, microscopic pan. This is small vessel to medium vessel vasculitis. Type 4 double positive, and type 5 double negative. This is a immunofluorescence picture. It may come into your MCQ exams later. This is a linear pattern. This is linear pattern is seen in anti-GBM disease or your Good-Pasteur syndrome, and this is granular pattern. Granular pattern is seen in membranous nephropathy. In case of membranous nephropathy also, immune complex deposition occurs between podocytes, and that's why it looks like quite bumpy. That's why it is named as granular. So treatment of rapidly progressing renal failure is when the kidney is salvageable. Steroids and cyclophosphamide can be given. Plasmapheresis might be done, and plasma exchange therapy, and renal transplant is also done in some cases. So that's the topic of RPGN. This much is sufficient. So thanks for the day, and if you like our video, please like, share and subscribe, and give your valued opinion.